Now, in the fifth section of our lecture, assessment of the hearing, we will talk about some evoked response audiometry. And in this, we will talk about electrocochleography, auditory brainstem response, and auditory steady state response. Evoked response audiometry are the computerized based test in which the stimuli is generated and intensity is increased or decreased. Here, if you see, the patient has headphones, and then there is one electrode is on the head, and it's labeled as CZ. And there is A1 and A2. Left click and right click, and that's usually the audiogram or audiograph. That's what is after the evoked response audiometry. That gives us on the left side we can have A1 CZ minus CZ, A1 first on the left and then right, A2 minus CZ, and then left A2 minus CZ, and right A1 minus CZ. And that's the four graphs you get on all four, right and left, A1, A2, A1 and A2. Then the electrocochleography is it shows the electrical graphing of the cochlea. In this that's in this you see it's the normal, in which the AP is the action potential and SP is for the summation potential. So after the stimulus, in the normal ear, usually the summation potential is 30% of the action potential. So normally summation potential is 30% of action potential. But after the electrocochleography, if this is the case in patients who have Meniere's disease, in which the summation potential is a lot, ratio is enhanced in this case. After the stimulus, the summation potential is enhanced, and it's a lot more than 30% of the action potential. Then the auditory brainstem response. Auditory brainstem response, that's the graph we get after the brainstem evoke response. And then if we see A is the amplitude of the wave is measured in microvolts from peak of wave to the peak of next drop. So this is the amplitude from the peak of one to the peak of another. That's the amplitude of the wave. Amplitude of the wave. Then what's the absolute peak latency? Absolute peak latency is the duration in milliseconds from peak of start of a click to appearance of the wave. So from the start of a click to the appearance of the peak of a wave, this is the absolute peak intensity. Then what's the interpeak latency? Interpeak is between the two peaks. Interpeak latency or interval is the duration in milliseconds between peaks of two waves. It's the difference between the peaks of two waves. So from 1 to 3, 1 to 4, all that is interpeak latency. Then we have interaural. Interaural peak latency is the difference in milliseconds of a particular wave between two ears. is the interoral. Oral is for the ear, inter is between. So it's the peak latency, which is the difference in milliseconds between two ears. So that's brain stem. So different things we can measure is amplitude of the wave, then we have absolute peak latency, interpeak latency, and interoral peak latency. Auditory brainstem response uses are, it is used as a screening procedure for infants. It is used to determine the threshold of a hearing in infants, also in children who do not cooperate and in malingerers. And it is also used to diagnose retrocochlear pathology, particularly acoustic neuroma. And it is used for diagnose brainstem pathology like multiple sclerosis or pontine tumors. It is also used to monitor cranial nerve 8 vestibulocochlear intraoperatively during surgery of acoustic neuroma to preserve the function of cochlear nerve. So these are some very important uses of auditory brainstem response if in the newborns, infants, non-cooperative malingerers, and to rule out any pathology of retrocochlea and to save vestibulocochlear nerve during surgery. Next, auditory steady state response. Auditory steady state response, that's the graph we get in the steady state response. Auditory steady state response. We have the electrodes attached to left hemisphere, right hemisphere, tangential and radial, and that's the recording of auditory steady state response. This is against the different graphs that shows the different features of auditory steady state response and as compared to transient steady state or transient event related potentials. So these are different graphs obtained as a result of steady state, and these are the transient event related potentials. So that was all about the hearing tests and hearing assessments, and we talked in detail in this lecture about all the different types of hearing problems and how we can assess them from just the basic tests to the complicated and more advanced tests. So thank you for watching sqadia.com.